Hey everyone, it's Dr. DeLopo, and I want to talk a little bit about how when you want things to happen with Chinese medicine, especially acupuncture, there's a momentum. I did a momentum video. There's a certain number of treatments you need to do as frequently as possible if there's something that you really need to fix. I don't care if it's pain or your immune system, you got a cough, you got a sore throat, or you got a headache. If you're not at least 50 to 80% better within 1 to 3 days, really consider coming back. When you go to elementsinharmonyacupuncture.com, I've spent the majority of my practice over the last 26 years. This is my third website, really enhancing, really showing what acupuncture can do. Migraines, blood pressure, diarrhea, anything you can think of, how frequent, when the benefits of frequent treatments. Frequent treatments is the key. So yes, I always guarantee 45 minutes for the treatment, and many people stay 1 to 3 hours. But in all honesty, many people don't have that kind of time, and I treat myself almost every day. And it's now March, and if you've been with me since last year, you probably haven't seen me be sick, and that usually means it has a lot to do with me giving myself 10 to 30 minute treatments almost daily. So I don't expect the average person to do that. That's a lot of time and costs money. But if you have an acute condition that you really need to fix, I did a video called, that's a 90-year-old woman. She lives alone. She's 91 now. And she initially, I treated her September 2 years ago. I fixed that condition. Last year, February, she came in 9 times in 11 days so she can get back on her Arabian horse, because she knew she happens to be one of the first nurse practitioners on the planet. She's a doctor of nursing. And she knew how my work goes. And so she knows if I'm going to get something done, that you have to be frequent. So if you're going to be doing acupuncture for something acute and you really want to fix something, especially if it's chronic and you're like, I want to get this job done, really considering bare minimum twice a week, if not 3 or more times a week, and do this for like 2 to 4 weeks. If it's really, really acute, like you just got a sore throat or whatever, see what can happen if you go 3 or more times a week for a week. You can fix it instead of living, let's say if you have a cough or sore throat or a migraine or sinus infection, you come, a lot of times people come in and be like, oh, I've been suffering with this for 2 months. It's like, if you had it for 2 months, I could have fixed it in a week or maybe even 2 weeks, so that's something to consider. Also, if you're taking herbs, typically the prescription is the formulas I prescribe are 3 capsules 3 times a day. Some prescriptions, that's if you have something acute. But if it's a maintenance, it might just be 3 capsules once a day. And the way I prescribe herbs is I want to see 50 to 90% improvement with acupuncture within 5 to 15 treatments. But if I'm prescribing herbs, I'm going to wait a little before I just put someone on a formula. And I'm going to do one formula at a time. I like to really isolate the variables when I'm in the process of healing someone. So let's say if you have severe IBS, you have constipation or diarrhea or something, you want to consider doing acupuncture for like 5 to 15 treatments. And if you're not at least 50 to 80% improved, then do the herbs. And there's a whole way that I prescribe herbs, but what I want to share is I'm not letting people be on herbs forever. That's something to consider. And if you are on a formula, it might be forever, quote unquote. It might be like what I do, 1 dosage a day for my immune system. That's how I stay so strong. You've seen me do other videos where I talk about my kids' health and how I nursed for a total of 8 years in my life for 3 kids. And their immune system is really powerful, and they've never been on antibiotics. As far as I know, I have a kid in college, and she's in charge of her own health now. But that's something I know about the other 2. So as far as I know, all 3 of my kids have never been on antibiotics. That has a lot to do with not just the fact that I nursed them, but also because received acupuncture since age 1, but definitely herbs almost every day since age 1. And so the frequency, that's the point of this whole video, is frequent, consistent. It's cheaper to stay on top of your health than it is to have an issue where you have an issue and now you have to respond to it. So be on top of it. And if you do get hurt, if you do have a health issue, try to fix it by at least 50 to 100%, 50 to 90% at least within 1 to 3 weeks. That's how the patients who've been with me since 1999, that's how they're trained. And that's how I get a lot of referrals, because they're like, oh, go to Anna, go to Dr. DeLobo, because she'll fix you as soon as possible. Things can be fixed instead of having to live with it for 1, 3, 6, 9 months or 2 years or 5 years, and your quality of life is being compromised. So something to consider. Elements in Harmony, acupuncture.com. Text us 619-341-4341. Office landline is 949-305-1703. I just subscribe to me on YouTube. Check me out on Instagram, LinkedIn, TikTok. If you go to Dr. Anna DeLobo, you'll see my other website, which is naturalpregnancyspecialist.com. It's a 3-month program, and I've done other videos on that. So check us out. Really, I like to get things done. I like to get things done quickly and have a game plan. Whoever is treating you should always have a game plan. All right? All right, you guys take care. Elements in Harmony, acupuncture.com. And for those of you who are really focused on getting pregnant naturally, we got a 3-month program. I have a 91+% success rate. I work with mommies and daddies. That is naturalpregnancyspecialist.com. All right, take care.